Neuropathy. What is neuropathy? Neuro, pathy, sick or ill, pathologic. So the term neuropathy is commonly used when people have burning, pain, tingling, numbness. That's an abnormal or pathologic sensation of what is in reality what's happening. So some people have problems with gait, stability, walking, because you can't perceive where you are in, if you're falling or moving forward or sideways, or that you're even touching the ground, that sort of thing. So neuropathy has lots of different faces. And I'm going to throw out a 50-cent word, neurovascular ischemia. So let me break that word up. Neuro, we already covered that, that's nerve. Vascular, so the blood flow to the nerve. So what does the blood flow to the nerves do? It brings oxygen, nutrients, sugar, because there's metabolism that's needed to happen in the live cells. And it also, blood will then take away toxins, breakdown products, and that happens in all tissues all over the entire body. So neurovascular ischemia, so that's a big fancy word. That means crummy blood flow, not good oxygenation, not good blood flow. So let's go back to it. Neurovascular ischemia means not good blood flow, therefore not good oxygenation, and not good clearing of normal metabolic waste down products. So, the kids aren't taking the trash out. Nobody's taking the trash out. It just piles up. And you know what happens in your kitchen if that happens? It gets stinky, and eventually it gets full, and eventually, whatever else comes with it. Well, not exactly, but similar to that happens in your body. You'll get swelling, you'll get edema, you'll get puffy tissues. So when we use the term neurovascular ischemia, that means that you're not getting good blood flow, you're not getting good oxygenation, you're not getting good nutrients there. And so you want to do that from the whole gamut. You want that to be, what you feed yourself. You want that to be that you're not overdoing activity that hurts. If it hurts, there's a reason it hurts. It's God giving your nerves telling you change or don't do what you're doing. Or it could be maybe you need rest, or maybe you need to elevate, or maybe you need something else. Okay, so pain is a signal. And eventually, if you ignore pain long enough, or if the nerve gets damaged, either by trauma or some way, then the nerve can't give good, proper signals. So if someone has a crush injury, hands get smushed, you might not feel it for a little while or at all ever. And that's a neuropathy of sorts, because you're not getting normal sensation. You're not getting any, or it's getting very sensitive to touch or something like that. So neuropathy is not a very good descriptive word of what's happening. It's just like saying, you got nerve pain. It doesn't tell much. But neurovascular ischemia is very, very specific as to what is causing that abnormal nerve problem. Meaning you're not getting good blood flow to it, and you're not necessarily perhaps getting blood flow away. So how do you fix that? Well, walking helps, exercise helps, activity helps, general movement helps, taking out the trash helps, and it can be through regular metabolism. There's certain vitamins and supplements that can help. I mean, there's a lot of things that go into this. Encouraging, if someone has swelling, to try to deal with that. Elevate your legs, maybe some compression socks or hose or something like that, because your nerves are going to be choked to death if there's too much fluid down there. It just makes a logical sense, but we're lazy and don't do that we need to. And then if you're diabetic and you have uncontrolled diabetes, high blood sugar also goofs with the ability to get normal nerve signaling. The normal blood flow gets altered. And eventually, when you have crummy blood flow, you have crummy nerve function, there can be infections that set in, or even dry gangrene, which is non-infectious, lack of good blood flow or nerve function to the extremities, and people lose toes or a whole foot or something. So you want to try to catch the process early in the whole thing, and not wait till it gets out of control. Unfortunately, That may be where some of y'all are. So how do you unwind some of that knot? How do you untie it? How do you undo it? Well, it's not always easy, and be patient because it doesn't happen all at once. But things you can do: eat healthy, control underlying issues with blood pressure, blood flow, be generally active, make sure if you have swelling, get rid of that as best you can. Medications, elevation, compression, whatever it takes. And then you start talking about vitamins, supplements. There's ways to do that that help with blood flow. One of the most common supplements for blood flow is this one here. Larginine lowers blood pressure. Right. It lowers abnormally high blood pressure. It helps improve normal blood flow, and it's through a little enzyme called nitric oxide. It's not technically an enzyme, but it's a nitrogen and an oxygen molecule connected together, and your body uses L-arginine or citrulline to make it. Citrulline's a little more expensive. This is a little less expensive, but we give this because that helps that enzyme to work to make the product nitric oxide. Nitric oxide then causes blood vessel relaxation. When that happens, you get a more vibrant, fuller flow through that blood vessel, i.e. better oxygen and nutrients to that area of the body, and you're going to get better drainage away, or taking out the garbage, if you will, from that area. It's really simple. It's not complicated, but we didn't know this until the last maybe 10 years, what L-arginine did, how it works, how it helps improve blood pressure, it helps improve memory, it helps improve heart function, and it helps improve neurovascular ischemia, the numbness, the tingling, the altered nerve function. All that's not magic, it's just you gotta give the things that help improve nerve function, body function, and get rid of the things that inhibit normal reparative processes. Any questions to that point?
Do you need a prescription for that?
No way. None of this stuff's prescription here. So we hadn't even talked about drugs yet. You know,
My doctor gave me gabapentin.
well, that's what we do. We're doctors. We prescribe drugs, right? So that's obviously, you're here for a drug because you done tried all this, but people don't know about this.
So can I get from gabapentin and get on that?
I would not advise you just stop any of your medications without talking with your doctor, number one. There are people that stop gabapentin. Gabapentin, if you look it up in the FDA, in the PDR, the big red book, or online, it's used to treat seizures.
Oh, really?
It's an anti-seizure drug. How does it work? It decreases the sensitivity, the signal to which to fire a nerve to fire and cause a problem. So it's like putting insulation, you go buy an old beater car and spend a couple $1,000s on it, but it's not going to be the same as riding in a BMW or a Lincoln. Nice and quiet, no road noise. Well, they put more insulation in there. So what you do to give more better nerve function is it adds more insulation. You can't hear the sound, it's still there. Well, that's just exactly what gabapentin does to your nerves. It adds more insulation so you don't hear the signal. So, not that you want to have loud, no analogy is perfect, but gabapentin makes it where that nerve doesn't fire as easily. It doesn't get as irritated. It doesn't make you think, I got pain. You need a drink? I'll get you something. What do you want?
Oh,
Sweet or unsweet?
Sweet.
That's the other one. And so gabapentin decreases the firing or the signaling of abnormal nerve signals. So gabapentin isn't harmful necessarily. Well, it can be harmful because your body has to metabolize that. If you also read the PDR, that big red book or online, it says older folks shouldn't take more than 300 milligrams without being very concerned about kidney function. Gabapentin can impair kidney function.
Yeah, I know this kidney doctor.
Yeah, you go to a kidney doctor. So he's going to be watching that too, watching your kidney function really closely. Well, that's true for every drug, everything. Even supplements, there's certain things you need to watch for. Usually they're less potent, they're less toxic, they're less, risky. But Gabapentin, if you just stop, if you're on a higher dose and you stop it, it can actually cause what we call a withdrawal seizure. Talk to your doctor or just slowly wean off of it before you choose to do that. There's other meds that we use for nerve pain, nerve function. Lyrica is a very common one, but we use other drugs. Some blood flow medicines, some sleep medicines, some anti-anxiety or antidepressant medications, because they too work on the nerves. They don't improve blood flow. They don't improve function of the nerve. They just suppress the abnormal signaling that comes from that nerve. That's how they work. Almost every one of them, that's exactly how they work. So what can you do to naturally improve that? It's all the things I just went through. Walking, exercise, improving blood flow, decreasing the swelling if you have that, increasing the nutrition, the nourishment. So that's what some of these other things do. And this isn't a vitamin show. I don't care if you buy these or not. But NAC is a good antioxidant. This helps take out the trash, metabolically speaking. This is helpful for restless legs. It helps a lot of people with twitchy nerves or just to help them sleep. This calms nerves and muscles. Magnesium is not just, this is a high absorption magnesium. You don't go buy the $3 magnesium at Walmart and expect to do with this. Now this is a big, huge bottle, it's $26. This is not that expensive, but it can help you not take meds that might be toxic or might be impair your gait, your risk for fall. This does not cause people to fall, but if you're on muscle relaxers or if you're on sedatives or sleep medications, there's all kinds of problems. We all know it. We don't need to go around the room talking about it. Alpha lipoic acid helps to improve the insulation. If there's cracked insulation on a nerve, damaged insulation or thin, this helps improve the insulation on the nerve. It's not the only thing that does it. It's just been studied, been shown it does it pretty well. Other things that can help improve insulation are just eating omega-3 oils, olive oil, coconut oil, fish oil helps improve the insulation as this is an antioxidant. You have to be careful with antioxidants. They cause side effects, okay? They can cause bleeding if you take too many of them. Early when I started using fish oil, I used it pretty progressively with high cholesterol patients, and it can cause bleeding. So this person had an issue and they were coughing up blood. Someone else can urinate blood. And so there's always things you need to watch out for. Everything has a risk. I mean, you could choke on your tomato or something like that. I mean, everything has a risk. But what's the relative risk? And it's really low on these supplements. Quercetin, this is a good anti-inflammatory. This is plant-based medicine that helps also with allergies. And here it says it helps to, it's a what we call a free radical scavenger that also acts like, as a detoxifier. Free radical scavengers help break down and carry out the metabolic waste that happens in your body just by regular metabolism. So everything you put in or on your body, you should think, how is this helping me or does it hurt me? And hopefully, you create a lifestyle of healthy living, healthy eating, healthy habits that you don't need a lot of drugs, medicines, you don't need a lot of surgery or procedures. And so, we also do, the latest fad is CBD. We do CBD oil. This is in a freezing, this is a gel that has menthol in it. So this has a little roll-on. You can roll it where it hurts. Nothing's perfect. It doesn't take away everything. But when you're talking about neuropathy, this can stop the burn, stop the pain. And as you increase your activity, as you decrease whatever underlying problem got you in that trouble in the first place, then we can help out. So we've had people with even chemotherapy, people with traumatic neuropathy that get improvement by doing a variety of things. So no one thing is going to fix it, because no one thing got you there, usually, and no one thing is going to fix the problem. So medications can help, but these are some great natural supplements that can help. We use red light therapy in one of our programs to help improve the blood flow even more. So the name of the machine is the Anodyne. But there's lots of red light products that improve blood flow. Be careful, don't overdo it, because you can burn yourself with red light. It can get hot, physically hot, and it can cause too much heating and even literally cause a burn. You don't want to have creams or gels or lotions on your skin when you use red light. You just be wise with it. Take everything off your skin before you use any red light. Question?
Yes, I've got a friend that's got neuropathy real bad. He's 96, and he's on hydrocodone, fennel patches, gabapentin.
Wow.
He's a walking zombie.
Wow.
And I was wondering about the oil. Now, will that show up in his bloodstream that he's got, that it's marijuana or?
No, this will not. There are some supplements over the counter that do have THC in it. And in Texas, it's regulated very, very tightly, although there's still some sold over the counter that shouldn't be. But we know for sure this does not. This product, and there are other products that don't have any THC. So if they go to work and they get urine tested, they'll be good. But that's a big risk, being medicated and driving, or, you know.
Oh, he's not driving, but,
Okay.
you know, the Bengay, he's even on the lidocaine patches.
Yeah.
But the Bengay works just as good, if not better, than the lidocaine patches, which are more expensive.
Yeah, that's right. Anyway, good having you. I hope lunch was good. And if you have any of these things you want more addressed specifically, I'll be here.